What to carry on the name? You think it's going to be a boy?
Yeah.
She was just the backbone of the family. She was always there for all of us.
Maureen Nottage loved life, but at the beginning of April 2020, she died alone in a care home. She had COVID. Maureen's daughter Kim says she's angry that the then Health Secretary Matt Hancock appears to have ignored expert advice that could have led to care home residents being protected more.
So to have free tests for, over 100 people and not knowing, and, it's where the postcode lottery comes into effect. And, they said that they done the test on Mum, but never even phoned up to inform the family that that's what they was doing. So we had no idea that she was that unwell. There'd already been about 10 deaths in that care home, and nobody knows what that was for. And people were just being discharged back from hospitals into that care home.
Hello, darling.
In early April, as we reported at the time, COVID was spreading fast through care homes. They were ill-equipped to cope. The NHS was often being prioritised for supplies of PPE and testing kits. Many care homes, like this one in Scarborough, decided to lock down much earlier than the government first advised. But in so many cases it wouldn't be enough. Without aprons, without masks, without testing, the virus would be allowed to spread. And in so many cases, the consequences were catastrophic. At the time, we put the concerns of care home owners to the Health Secretary, Matt Hancock.
The care sector is watching this right now and is desperate for you to tell them that they will get regular tests so they can end this lottery. Can you give that guarantee to them?
Yes, I can, Nick. That is coming.
So, to my mind, if you cast your mind back to April 2020, it was all about testing and the NHS and PPE.
Mike Padgham owns 5 care homes in North Yorkshire and has been in the care industry for 30 years. He thinks the decision not to test everyone entering homes at that time was a crucial mistake.
Looking at these WhatsApp messages, how does it make you feel knowing what you know now?
Well, when I saw the messages that have been reported, I was quite shocked, really, because as a layperson, which I call myself, is that if tests could only be done being discharged from hospital into care homes, then surely the community should also have been a priority, because a lot of the issues were the virus coming in by members of the community and even staff. So to my mind, it should have been both.
Decisions made in these early, often chaotic days of the pandemic will of course be pored over by the independent inquiry. The question is, were these sound judgments under pressure or costly mistakes? Nick Martin, Sky News, Scarborough.